Hello, everybody, and welcome. It is Nurse Eunice with Florida Training Academy, and in today's video, we're going to do a vital signs quiz. So I'm going to give everybody about 10 seconds. I know the notifications are just going out. So again, this is Nurse Eunice with Florida Training Academy, and we'll get started shortly. All right, everybody. So number one, which of the following vital signs is considered the most sensitive early indicator of hemodynamic instability? Is it A, blood pressure, B, heart rate, C, respiratory rate, or D, oxygen saturation? All right, so we have an A as an answer. Anyone else? Hi, Lynn. Hi, Ifioma. Hope I pronounced that correctly. Hey, cartoons. All right, so far we have A, we have C. Hi, Marcia. Any other takers? We'll reveal the answer in 3, 2, and if you chose C, yay, you are correct. And so on the next slide, I'll explain it. But whenever someone still has a pulse, our priority is A, B, C. Airway, breathing, circulation. So the respiratory rate is the correct answer because it can often detect early changes in response to psychophysiological needs, and it's a sensitive marker of hemodynamic instability before changes in the heart rate or blood pressure are observed, which is why you're supposed to count those respirations for 1 full minute. Don't cheat and just document 16 or 20. And so, when your patient has a pulse, when the resident has a pulse, when the resident is still alive, you need to be thinking about the A, B, C's. This is the priority, making sure your patient is still breathing, airway. And then after that, we can focus on the circulation part. The disability would be like what diseases they have, such as diabetes, kidney failure, and exposure. Maybe your nurse gave them a medication that was too strong to their for their system, or maybe it was something that was toxic. So the correct answer for that one was C, and congratulations. Number 2, everybody, a 55-year-old male presents with a heart rate of 120 beats per minute. The blood pressure is 80 over 50 millimeters of mercury. He is cool, clammy. Which of the following conditions does he most likely have? Is it septic shock, cardiogenic shock, neurogenic shock, or anaphylactic shock? Hello, everybody. All right, I see some answers coming through. This one's a tough one. I see D. I see a B. Oh, we're torn between D's and B's. I need 2 more responses and I'll reveal the answer. And of course, the next 2 responses were D and B. So everybody, we know that it's either cardiogenic or anaphylactic. And here's the correct response. It is B, cardiogenic. So the presentation of tachycardia, which is a fast heart rate, hypotension, which is a low blood pressure, and then the cool and clammy skin. The skin is cool and clammy because the heart is not enough circulation, it's not enough perfusion. That is that's indicative of cardiogenic shock, which is typically due to low cardiac output. So remember, with anaphylaxis, that's usually related to like some type of reaction, and that person would have more respiratory issues in addition to possible tachycardia. And here's an illustration of cardiogenic shock. For this one, I want you to pretend that the heart is a pump. In this illustration, we have the pump being a gas tank. And then the tube that the actual fluid runs through, the vessels, and then the very end of the pump, that's the blood volume. So whenever the heart or the pump isn't pumping correctly, as in with cardiogenic shock, there's not enough gas, aka blood, circulating through the body. And that could happen due to acute coronary syndrome, dysrhythmias or abnormal heart rhythms, congestive heart failure, valve problems, drug overdoses, myocarditis or an infection in the heart, and then myocardial contusion or injury. Next one. All right, number 3. This one's going to be easy. What is a normal range for the adult systolic blood pressure? Is a normal range 90 to 20, 100 to 130, 110 to 150, or 120 to 160? Which of these would be a normal blood pressure range for the systolic blood pressure, or the top number of the blood pressure reading? All right, I see A, I see B, I see a lot of A's. Oh, this is exciting. I see a B. All right, so everybody, if you chose B, you are correct. So for A said that the systolic was 90. When the systolic is less than 100, we consider that to be hypotensive. So a normal systolic blood pressure range, depending on what textbook you're reading, is going to be 100 to 130 or 100 up to 140. So it just depends on what they're teaching you in nursing school. If your school is saying something different than what I'm saying, please go by what your school says, because I need you to pass your exam. But the systolic normal range is 100 to 130 millimeters of mercury. So great job if you selected B. Next, number 4, a 70-year-old patient is found to have a blood pressure of 190 over 100. Which term best describes this condition? Is it hypertension, hypotension, orthostatic hypotension, or no more tension? I see A, I see A, I see a lot of right answers. Great job, team. So yes, in this instance, both the systolic and the diastolic numbers are high. So this is outside of normal range, is higher than normal, and this will be referred to as hypertension. Number 5, in which condition is bradycardia, or a heart rate less than 60 beats per minute, commonly seen? Is it diabetes, sepsis, ventricular fibrillation, or hypothermia? This one's hard. In which of these is bradycardia commonly seen? We have B and we have D. We have another D. If we get 3 Ds, we have 3 Ds. So guess what, you all? It is hypothermia. You're right. So bradycardia is a common response to hypothermia. And so when you think about the body becoming extremely cold, I live in Florida. So those iguanas, they freeze in the winter. They hit the ground. And that's because their body systems are shutting down. They're going to sleep because everything's so cold. And then as soon as it warms up, they get up and they move again. So a human may not be as fortunate, but here we go. With hypothermia, or with the body temperature being lower than normal, they can start becoming confused or having irrational behaviors. The heart rate slows. Of course, initially they start feeling cold, but when it becomes really severe, they can feel like they're burning on the inside. Because of the confusion, they're also going to have slurred speech. They're going to be shivering in order to try to overcome, the cold temperature. And then, of course, the clumsiness is when we find them on the ground, unresponsive because they've fallen in the snow, etc., because they just couldn't continue. They were so cold. So Low blood pressure or low heart rate is a side effect of someone who is really cold, and we call that hypothermia. Number 6, which of the following is not a sign of hemodynamic instability? Altered mental status, tachycardia, hypotension, or hypothermia? Hemodynamic instability. Hemo, blood. So if someone has poor perfusion, what are you not likely to see? Rose, I don't have a schedule. My schedule is freaking crazy. I teach classes, I run a business, so I do try to get on twice a week, but it's not consistent, and I do apologize. All right, so everybody, I do see, is it Enoop? Enoop has it. Hypothermia is not, or hyperthermia, excuse me. That usually doesn't happen when someone has cardiovascular issues. Hyperthermia may happen if they have an infection. So I'm going to read this rationale. While hyperthermia may indicate infection or other conditions, it is not a direct indicator of hemodynamic instability like altered mental status, tachycardia, or hypertension. Let's see what we get for number 17. Number 7, a patient has a rapid, weak pulse and a systolic blood pressure of 70. Oh my God. This is most indicative of hypervolemia, hypovolemia, normal hemodynamics, or a stable condition. What do you think, team? The top number of their blood pressure is 70. I see so many correct answers. Yes. They have hypovolemia or low blood volume. So a weak and rapid pulse and a low systolic blood pressure suggest hypovolemia. And so that can commonly occur due to dehydration, or if someone is urinating a lot due to a disease state. Also, it could happen if someone is experiencing blood loss. Think of someone who could be post-operative or after surgery. Number 8, what is the most likely cause of hypotension in a patient with severe dehydration? Is it decreased vascular resistance, increased cardiac output, reduced blood volume, or increased blood viscosity? Yes, in most cases, dementia is permanent. You can treat it, but you can't reverse the dementia. It's a progressive disease, so it gets worse by nature. I think Ama and Shahel, I think you all have it right. So the correct response to number 8 is C. So let's go back and read it again. What is the most likely cause of hypotension in a patient with severe dehydration? And I know we want to think increased cardiac output, but it's actually the reduced blood volume. Because if you don't have enough fluid circulating, that means you don't have enough blood circulating. So severe dehydration reduces blood volume, thus leading to hypotension. And here are some of the dehydration symptoms. Of course, we have thirst, dry mouth, their lips may appear chapped. The heartbeat can raise, they can be confused. They're going to have decreased capillary refill and also decreased urine output. Number 9, which of the following is the best indicator of tissue perfusion? Is it blood pressure, heart rate, capillary refill time, or respiratory rate? Oh, got to put your thinking cap on for this one. best indicator of tissue perfusion? What do we think, team? What do we think, team? Oh, you all aren't responding as fast with this one, so I know this one's hard. But Suhail and Philomena, you all have the correct response. For you all, if you don't understand some of these terms, make sure you watch this video again and take notes, because the best indicator from the list of tissue perfusion is going to be the capillary refill time. And so the capillary refill time provides a direct indication of peripheral perfusion. And on the next slide, I show you how to check someone's capillary refill. And so you would literally press on the tip of their finger until all the blood flow leaves, until the finger becomes pale, the fingernail or the fingertip becomes pale. And then when you release it, you count how many seconds it takes for that finger, for that nail to return to its pink color. And the goal is for the capillary refill to be less than 2 seconds. And so if it's longer than 2 seconds, if it's 5 seconds, that would be an indication that the person has poor perfusion, that they're not getting enough oxygenated blood to their extremities. Number 10, a 25-year-old female presents with a blood pressure of 85/60 and a heart rate of 55. Which condition does she most likely have? Is it anemia, hypothyroidism, dehydration, or Addison's disease? Teaching you something new. That is abnormal for a 25-year-old to have a low blood pressure and a low heart rate. So there must be something going on with her that's also not normal. And I see a lot of dehydration. And I'm just going to show this one because this is a new term that you all may not have seen before. And Rosina has it. It is Addison's disease. So sometimes they have gland issues or hormone issues that can cause their body and their heart rate and their blood pressure to decrease. So Addison's disease can present with hypotension and bradycardia due to adrenal insufficiency, which is why sometimes we just tell people, oh, drink some water, lay down, you're going to feel better. Some people need to go to the doctor. Not everybody can just drink water and feel better. And so with Addison's disease, it is a primary, it's caused by a primary adrenal insufficiency. They get a bronze skin or kind of like a brown pigmentation, even if they're Caucasian. They can start having weight loss, low blood pressure, low blood sugar, hypoglycemia. They can start having stomach issues like nausea and vomiting. They also become weak. And of course, the fatigue and the low mood because their heart isn't beating as well as it should, and their pressures are also low. So this person feels very tired. Number 11, which sign is least likely to be seen in a patient experiencing hypovolemic shock? Let's break it down. Low volume. If someone has low blood volume, what are they least likely to have? Is it tachycardia, hypotension, warm, flushed skin, or cool, clammy skin? If my heart isn't pumping the way it should be pumping, what am I least likely to have? Yes, everybody. Yes. I'm so proud of you all. So a lot of you all chose C. And C is right, even though the image that I have there doesn't show what the correct response was. So if someone's cardiac output is low, their skin is not going to be warm and red or flushed. If they have low cardiac output, their skin becomes pale, even if they are brown skin. If they are African American or Hispanic, their skin becomes pale and clammy or moist. And so this picture shows you what someone looks like when they have low cardiac output. Number 12, which vital sign is most directly affected by the sympathetic nervous system activation during stress, or sympathetic, excuse me? Is it blood pressure, heart rate, respiratory rate, or temperature? And when you think about the sympathetic nervous system, I want you to think fight or flight. So, which vital sign is most directly affected when you get a boost of adrenaline? I see A's, I see B's, and you all revealing the answer in three, two, and one. You know when you're watching a scary movie and you get excited, you usually don't have a raise in your blood pressure. You have a raise in your heart rate because the sympathetic nervous system increases the heart rate as a part of the fight or flight response. And so on the next slide, we'll talk about the autonomic nervous system. We have the sympathetic versus the parasympathetic. So we're going to start on the side that has the arrow pointing up. This is the fight or flight side. So with the sympathetic nervous system, it increases the heart rate, the respiratory rate, the blood pressure, and then the pupil dilation. But notice heart rate was first. It also decreases digestion and urine production. On the parasympathetic side, it says rest and digest. So that's why I have the arrow going down because it increases digestion. However, it decreases heart rate, respiratory rate, blood pressure, and pupil dilation. In other words, you won't see as well. Versus on the other side, whenever you're nervous, fight or flight, you're on high alert, those pupils dilate so you can see and visualize things better. Number 13, a 40-year-old male is found unconscious with a blood pressure of 60 over 40. Which immediate intervention is most appropriate? Administering intravenous fluids, giving oral glucose, applying a warm blanket, or administering oxygen via a nasal cannula. So whether this will be part of your job duty or not, if a patient has a blood pressure of 60 over 40, what do you think the medical treatment is going to be? Yes, that nurse needs to start that IV ASAP. This person needs intravenous fluids. So extremely low blood pressure suggests shock, and administering IV fluids is a primary intervention to restore circulatory volume. And so the reason why I didn't just focus on numbers for this for this vital signs quiz is because you all know your numbers. I needed you to know when your patient's pale and they're not responding to you that there could be something going on with their vital signs. And as long as they have a pulse, you focus on ABC. If they're pulseless, of course, you're going to call your code, and we're going to focus on CAB, which is circulation, airway, and breathing. So knowing vital signs isn't enough. I need you to know some of the reasons why your patient's vital signs would also be low or altered. Number 14, which of the following is a common cause of tachycardia? Is it beta blocker overdose, hypothermia, pain, or hypothyroidism? I expect everyone to get this right. This one's super easy. Common cause of a higher than normal heart rate. Yes, D-Real. Yes, Karen. Yes, Cassandra. You all have it. It is pain. So pain can actually activate the sympathetic nervous system, leading to tachycardia. So when a patient experiences pain, when a patient's heart rate is high, one of the first things we'll ask, are you in any pain or are you stressed? And for this image, I thought it was really important to show a minority woman, an African American, because of disparities in healthcare. Some people do not think that we experience pain, and or they don't take our pain seriously. And that is why maternal deaths during childbirth or pregnancy, the rates are so high. So if you are taking care of someone who is brown skinned and they're telling you that they're in pain, believe them and notify your nurse. If you are the nurse, do your assessment and then notify the doctor. Number 15, what is the normal range for adult respiratory rate? Is it 10 to 16, 12 to 20, 15 to 25, or 20 to 30? What is the normal range for the adult respiratory rate? And we'll reveal the answer in 5 seconds. 4, 3, 2, and everybody got it right. Yes, it is 12 to 20 breaths per minute. Great job, team. Number 16, a patient with a blood pressure of 80/40 is most likely experiencing hypertension, normotension, hypotension, or orthostatic hypotension. Yes, yes, yes. So for this one, it wasn't anything tricky. It was C. Orthostatic hypotension is when you change your patient's position, and the higher they sit up, the more their blood pressure decreases. And so usually we will order high orthostatic blood pressure checks to make sure a person is going to be safe before we start walking them. So for this one, it didn't talk about position changes. So the correct response is just going to be C. Number 17, what is the most common cause of non-traumatic cardiac arrest in adults? Hypovolemia, hypoxia, coronary artery disease, or electrolyte imbalance. So there was no injury and this person's heart has stopped. What is the most likely cause? Yes, 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 yes. Coronary artery disease. So, coronary artery disease is the leading cause of non traumatic cardiac arrest in adults due to its impact on the heart's ability to function. And so, here we have an image of the heart. And in addition to the image of the heart, we also have a circular area that shows an artery. And the yellow part is the fat. It is the cholesterol buildup. And so much cholesterol has built up until it has limited the amount of oxygenated blood going or flowing to the heart, which when the heart becomes damaged, it starts to die. And so the person's heart can actually go into an irregular rhythm or it can stop altogether. And so coronary artery disease, aka heart disease, is the leading cause of cardiac arrest when it's not related to a trauma response, such as what happened with Damar Hamlin on the football field. Number 18, which of the following vital signs changes is most concerning in a post-operative patient? Is it a blood pressure of 110/70, a heart rate of 100, a respiratory rate of 22 breaths per minute, or an oxygen saturation of 88% on room air? All right, your patient just came back from the OR. Maybe she had a cardiac stent. Maybe she had a hysterectomy. Maybe he had his toe amputated, but he's now your patient. Which of these vital signs are you most concerned about? Ooh, I haven't seen the correct answer yet. I finally saw it. So, Corin, you have it. And Sony, it is going to be D. You all remember, we talked about A, B, C, airway, breathing, circulation. So, whenever someone is post op, we really have to focus on their respiratory system and also their oxygen saturation. And so, somebody who is post operative, if their O2 sat is 88%, your nurse might want to consider notifying the doctor and getting some low flow oxygen for them, or if their respiration rate is low in addition to their O2 sat being low, we may have to reverse the effects of that anesthesia by giving them some Narcan or something to bring them out of that sedated state. And so an oxygen saturation of 88% is significantly below normal and indicates hypoxemia, which is critical in post-operative patient care. So we mentioned the anesthesia, it slows everything down. The person isn't taking deep breaths in and out. And so usually want to keep their O2 sats above 94%. I think someone put in the chat 88 to 91. That is not the US standards. Usually less than 94, we want to be calling the doctor unless this person has a previous history of a low oxygen levels. Number 19, a patient with a history of hypertension presents with sudden onset chest pain and dyspnea. What is the most likely diagnosis? So chest pain and shortness of breath. Are they having a pulmonary embolism, myocardial infarction, aortic dissection, or a pneumothorax? Yes, yes, yes. So many good answers. Yes. And so I did see where someone put C, aortic dissection, but that's not common. Usually it's going to be B, myocardial infarction. So sudden chest pain, shortness of breath, somebody who has a history of hypertension. We know that those arteries, those vessels are damaged, including the arteries and the vessels within their heart due to the high pressures. And so if they start having chest pain, we'll usually order an EKG because it can truly show us whether or not the person is having any abnormal changes with their heart and help to diagnose whether or not they're having a myocardial infarction, aka a heart attack. Number 20, which of the following conditions is characterized by paradoxical pulses, or we call it pulsus paradoxus? And this may be a term you never heard of before, so you can write it down and research it later. But is it cardiac tamponade, pulmonary embolism, hyperthyroidism, or aortic stenosis? Paradoxical pulse. In other words, when they take a breath in, their heart rate drops. Pretty scary, right? And so for this one, we'll reveal the answer in 3, 2, and I do see a correct answer. Great job. It is A. It is cardiac tamponade. So pulsus paradoxus is a classical sign of cardiac tamponade, or when the pericardial sac, the sac around the heart, is filled with blood. It doesn't allow the heart enough room to expand. So it happens when there is an exaggerated decrease in the systolic blood pressure during inspiration. So the heart rate can decrease, but also the blood pressure can decrease too every time the person takes a breath in. And on the next slide, I have some of the common causes of the pulsus paradoxus. And it could be acute asthma, congestive heart failure, chronic obstructive pulmonary disease. It can be cardiac tamponade. Let me just move this out the way. It can be tension pneumothorax, where a person has a leaking or a damaged lung that requires a chest tube. And it can also be pericarditis, which is swelling around the pericardium or the lining around the heart. All right, number 21. What is the normal range for adult body temperature measured orally? I don't do Celsius to Fahrenheit conversions. Thank God for computers and calculators and technology. So I'm going to stick with the Fahrenheit side. Is it 95.9 to 97.7? Is it 96.8 to 98.6? Is it 97.7 to 99.5? Or is it 98.6 up to 100.4? Oh, so many of you all got this right. Good job, team. So even though it said oral, I did not find a picture of someone getting their vital signs or their temperature taken with an oral thermometer. I have the thermal scanner here, but it's pretty much the same. The oral body temperature is from 97.7 to 99.5. So what I like to think of it as anything from 97s to 95s, we're good. If it's, excuse me, 97s to 99, we're good. 99.5. When it starts creeping towards 100, I want you to think about the environment, because when you have an elderly person who is in a facility, more than likely the room is hot. They have on multiple blankets and they're probably also drinking coffee. So if any of that is actually going on, you cannot take that temperature right then, because you're going to get an abnormally high temperature. You have to change the environment. Either pull back some of the blankets, move the coffee cup, and let the patient know you'll reheat the coffee later. But if you give us an abnormally high reading, we're going to have labs and different diagnostic tests ordered on the patient, such as blood cultures, sputum cultures, urine cultures, and they didn't need that. They needed a CNA who cared enough to go back in 15 minutes and recheck the vitals. So anytime it's outside of normal, regardless of what the vital is, you recheck it. But if it's the temperature, change the environment, take away the coffee, wait 15 minutes, and then come back and recheck it. And now, if it's still abnormal, that is when you would notify your nurse. Number 22, a patient with septic shock is likely to present with which of the following sets of vital signs? Is it a heart rate of 110, blood pressure of 90/50, a respiratory rate of 24? And for this one, because it's so much information, I'm not going to talk it out. So I give you about 20 seconds to look over it and let me know what you think the best response is. All right, revealing the answer in 3, 2, we have a lot of A's and a B. And yes, for all of you all who chose A, phenomenal. So the heart rate is higher than normal, the blood pressure is lower than normal, and the person has a semi elevated respiratory rate. And so septic shock typically presents with tachycardia, hypotension, and tachypnea, or a faster than normal breathing pattern. Great job, team. 23. Which of the following conditions can cause secondary hypertension? So that means that the hypertension was not caused by the heart. Which can cause hypertension? Is it chronic kidney disease, hyperthyroidism, Addison's disease, or diabetes insipidus? Yay! Everybody's choosing A. And you're right. It is chronic kidney disease. I get so happy. Y'all make me so proud. So, chronic kidney disease can lead to secondary hypertension due to impaired renal function and fluid retention. You should be very proud of yourself. I'm very proud of you. Number 24, a patient presents with hypotension, distended neck veins, and muffled heart sounds. This one is hard. What is the most likely diagnosis? Tension pneumothorax, myocardial infarction, cardiac tamponade, or pulmonary embolism? And those muffled heart sounds, why would the heart be muffled? Why is it hard to hear? Oh, Anthony, you got it. Karen got it. And who else? Yes. I guess it wasn't that hard at all. I got to do better with my test. You all, it is cardiac tamponade. So the combination of hypotension, distended neck veins, and muffled heart sound is known as Beck's triad, and that is indicative of cardiac tamponade. And on the next image, we have the pericardial sac, and it is filled with fluid. So the heart can't move. It can't pump like it would normally do because it's limited by all that fluid that's around the heart. And so this is what we mean when we say a person has cardiac tamponade. So that's why when you listen, you wouldn't be able to hear clear heart sounds because it's muffled due to that excess fluid. And the way we get rid of that fluid, wonderful person called a cardiologist will do a needle decompression. They can insert a needle. Of course, you know it, they'll have them in surgery, but they would have to remove that fluid from around the heart so the heart can pump normally again. Number 25. What is the first line treatment for a patient with hypovolemic shock? Is it vasopressors, intravenous fluid, administration of blood products, or mechanical ventilation? First line, easiest. What's the easiest thing to do when someone has hypovolemic shock or low blood volume? Yes, yes. We're going to hang some fluids. That's the first line treatment. Remember, not is sometimes when someone has low blood volume, it's not due to blood loss, it's due to the fluid. So the blood doesn't have enough fluid to actually flow through. And that's how we can restore the circulatory volume with IV fluids. And so my team, my friends, you all did so well. I love you all. And I missed you this week. And so I think this week I should be able to come on again on Thursday. So if you have any video ideas, you're welcome to put them below. But great job, wonderful. And let's see, fluid, isotonic fluid. So yes, Target, you're absolutely correct. We can do some LR, we can do normal saline. So I'll stay around for a few moments, you all. Let me know what video ideas or suggestions that you all have. And if you don't have any, I'll see you in the next video. Bye, everybody.